Welcome everyone. My name is Nicole Wessig and today's presentation will be covering anaphylaxis and epinephrine administration. To be able to understand these concepts, we will need to review pertinent information about common allergic triggers, signs and symptoms of an allergic reaction, how to administer epinephrine autoinjections, where they are stored, and what your role is in the emergency response system, and how to react appropriately to an anaphylactic event in a variety of settings. As you can see from this slide, there are a wide array of allergens that can trigger an allergic response. Avoidance of allergen is a primary prevention concern for the school setting. It is recommended that these precautions be implemented for all students regardless of their diagnosis. In doing so, you will not be singling out just one student, which will prevent FERPA and HIPAA violations from occurring. Allergic reactions can occur anywhere and at any time. Some students may present with a slight cough, watery eyes, and tingling of the lips. These symptoms can easily change into a severe allergic reaction called anaphylaxis. This is a life-threatening emergency where it is pertinent that epinephrine administration be administered immediately. Emergency medical treatment for anaphylaxis is epinephrine. There are various forms of epinephrine injections in the school setting, as you can see pictured in this slide. The first one I will demonstrate for you is the one on the left, and it is called an EpiPen. To administer the EpiPen, you want to remember blue to the sky, orange to the thigh. This orange is where the needle will come out to be able to administer the medication. You will remove the blue cap like this and place the orange end to the medial lateral thigh. You will then press down firmly until you hear a click like this, and then count to 7. This ensures that all of the medication is administered into the patient when you release the pen, and the orange sheathing will cover the needle to prevent you or anyone else from being stuck. The autoinjector on the far right is similar to the EpiPen. It also has an orange tip, so you'll know which end to put to the thigh, but you'll need to remove the top and bottom blue pieces. After administering this autoinjector, the needle will still be exposed, so you need to be careful that no one gets stuck by this needle. The middle autoinjector is called an AviQ, and it is very interesting as it will talk to you through the steps, as you can hear.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
That one's pretty neat. A lot of the kids like them because they'll put them in their back pockets and stuff like that. Areas where autoinjectors might be stored are the school clinic, and students may also self-carry these items depending on their age. If you have a student that self-carries, you want to discreetly ask them where they store their autoinjector. This way you can ensure that it is in an accessible location. You also need to make sure before you go on a field trip that the autoinjector is either with the student or with you before you board the bus. This is a good precautionary measure before leaving for any extracurricular activities. School staff can make a difference in reducing the fatalities that occur from anaphylaxis within the school setting. By being properly trained in the use of epinephrine autoinjectors and understanding the pathophysiologic events for anaphylaxis, it will increase your confidence in your ability to react to an anaphylactic event. Responsibilities of the emergency team during the school day. You, as teachers, spend most of the time with the students and are the first ones that usually will witness an allergic reaction. This is why it is very important for you to recognize symptoms to start the chain reaction. If a student is presenting with some mild symptoms that you are unsure about, have another student escort them to the clinic for further evaluation. If the student is presenting symptoms of a severe allergic reaction, press the emergency call button, state the situation and the name of the student, and then clear the room. If the student self-carries, you need to find the epinephrine pen and administer it. At the same time this is happening, the school nurse and administration are being notified and they're en route to your location. 911 is also being called, and when the EMTs do arrive, they will take over care at that time. As you can notice in this chain reaction for extracurricular activities, there are some missing members. You are still the first line in recognizing the life-threatening emergency, but now you will also be responsible for calling 911. As discussed earlier in the presentation, you are responsible for ensuring that a student with a known allergy has their epinephrine injection readily available before boarding a bus. The last thing you want to happen is that the auto-injector is in the clinic and you are on a field trip with a student that starts exhibiting signs of anaphylaxis. Let's discuss some situations that can possibly occur within the school setting. This situation has to deal with a class party and a student that has a known tree nut allergy, and she just ingested some Nutella. What should you do for this situation? That's right. The student should be sent to the clinic with another student because you don't know how the student may react after ingestion. In this case, the student was picked up by the parent and then spent the next week in the hospital. In this situation, Annie has a stomach ache, which she seems to complain of on a daily basis. You know she has a peanut allergy, which she also knows how to avoid that trigger, but you don't know if she shared someone's lunch at the lunch table. You start teaching and notice several concerning symptoms, such as her lips are slightly swollen, her face is flushed, and she's scratching her neck, and she's also sounding like she's starting to wheeze, which is kind of like a high-pitched sound where they're like, because of constriction usually in the throat. What would you do for this situation? Yes, you would activate the emergency response team by pressing the call button. Because of the age of the student, it is important for you to state the situation and the student's name so her auto-injector can be retrieved from the school clinic to be able to be administered in a timely manner. This is the last situation. Billy is allergic to bees and wasps, and they seem to be everywhere just outside the bus, and you're trying to get to the basketball game. What would you do for this situation? As a teacher, you must advocate for your students, especially when it comes to student safety. That is why you might ask the bus driver to pull up to a different entrance, just to get away from the bees so you don't have to worry about them. In conclusion, it is very important for school staff to provide a safe environment in various settings. This can be accomplished through training to improve outcomes from a medical emergency to alleviate fears of the parent. Does anyone have any questions at this time? Okay, now that we have concluded this training, you will need to provide a return demonstration of the administration of epinephrine with your county school nurse. She will schedule a day to where you can stop by in the front office during your planning time. If you have any further questions that you think of between now and then, you can ask them at that time. Thank you.